could your child be taking an off-label medication that's not approved by the FDA for their given condition? New research from Rutgers University says doctors are prescribing children one or more off-label drugs about 1 out of every 5 office visits. Now, this is not inherently a bad thing, right? It depends, but what are your thoughts? Because 1 out of 5 seems relatively high.
Right.
But when you hear this statistic as a pediatrician, you're thinking, yeah, that's about right. That's kind of what I use in my practice. Or were you surprised by this?
No, I'm actually not surprised by this. So what does off-label actually mean? Off-label is the use of prescription and over-the-counter medications in a patient population that it wasn't tested on and for a medical indication that it wasn't researched on. So, for example, in my practice, a lot of the medications we use are antihistamines, like Claritin, for example, that are normally used for allergies. We would use them for kids under age 2 if they have an upper respiratory tract infection to help with the congestion so they can breathe better. Or for patients with asthma that don't have allergies, antihistamines really help reduce that wheezing and congestion so those patients can breathe better. So when we're giving them these medications, we're doing this for therapeutic purposes. We're there to help out the patient.
And in this case, you're talking about a fairly benign class of medications.
Right.
Have you seen many cases where, maybe these off-label prescriptions that are being used are a little more scary, or maybe the doctor is being a bit more cavalier?
Well, I mean, when I was in intensive care unit, when I was in training at USC, we used things like Sudafed liquid drops. These are contraindicated in kids under age 2, but they were really having difficulty breathing. So we would turn it into a liquid form and just put a few drops in their nose. Yes, it's dangerous because it can increase their heart rate, blood pressure, but we're there in a monitored setting. So we're mindful of what we're giving to our patients. We follow them. We make sure that, we're doing blood work if need be, making sure their vitals are stable, things like that, so we're not harming them.
And I think it's important for everyone to always remember kids are not just small adults. That's why talk to your pediatrician before you even use an over-the-counter that may not be recommended for kids at that age. The doctors.
12 years in!
The prognosis you prayed for.
For the first time in public, I want to see if she can take a few steps.
This is so scary.
The treatment you needed.
You look fabulous.
It's the daytime talk show that's been your cure for over a decade. That is literally taking the lives from their community. I can't believe that this is happening. With the issues affecting your health right now.
It is not housing, it is not economic inequality, it is a health crisis.
I lied to you, and I lied to you. I have a truth that I'm going to reveal.
The Doctors, on call for season 12.